The Things We All Carry is a podcast about first responders and their stories surrounding trauma on the job. The intention of this podcast is to raise awareness and share meaningful conversation around a subject often viewed as taboo or simply ignored. Be aware this content may be graphic and it is real. It may not be suitable for children or adults triggered by this subject matter.
Well, we're back. It's been a while. It's been a while since I sat down in front of this mic just to talk to you guys and to intro a show. I decided that I needed to take a few weeks off. I needed to recalibrate, kind of recenter my head and my brain and my mind and kind of figure out where I want to go from here. And I've started to do that, started to move down some paths. And I've got a lot more figuring out to do, but I'm ready to put some shows out. And today, I'm going to release a show from, her name is Alex, and you can follow her on Instagram or TikTok. She's at Emergency Resilience. And the reason I chose her show is because one of the things she said in her show resonated with me, and it's one of the reasons I decided to take a break. Alex talks about her experience with ketamine therapy, and at one point she discusses the sessions she went through where she said she cried the entire hour. And when she came out, she realized she was crying for grief, but it wasn't her own grief. It was the grief she had taken on from everyone she had worked with. And it kind of struck me as like, you don't process these things. You don't take a break from these things. You don't kind of get some air and some separation from these things. You do take a lot on. And this show is starting to weigh on me a little bit. And so I decided I had to take a break. I had to step away for a minute. I had to be human. That's what it is, I think. And I'm back because I really want to get some shows out to you. I want to keep refining and retooling things. But I still want to get this content out to you. And I've got some stuff already recorded that's just ready to go. And their stories have sat for long enough. And so I want to share them with you. As for me, I was asked the other day how I was doing. It was one of my friends, one of my former crew members, and he asked me how I was doing. And I told him honestly, this is one thing I don't think even I do enough of, is just answering that question honestly. And I told him I was struggling. I found that this step away from the fire service hit me harder than I expected it to. And I was on a roller coaster, and I still am. I have good days and I have really bad days, and I just want to isolate and stay away from people. But I have to recognize that I put myself in this situation. I chose discomfort for a reason, and I need to pursue that reason, and I need to chase it down. I need to go out and make it happen. And so that's where I am now. And I'm thankful for the audience. I'm thankful that you guys showed me some patience while I stepped away and kind of recalibrated. But like I said, I'm ready to come back. I'm ready to release some shows. I'm ready to move the show forward and ready to explore other avenues. And some of that is some more writing. Some might be another show in its entirety. And one of the other avenues is just making some changes here. I'm going to shorten up some episodes. I'm going to add some video. I'm going to kind of find a better formula for the show. So still bear with me while I fine tune and tweak and explore and experiment. This has been a strange ride. It's been 2 years of podcasting, and this is something I didn't know how to do. I had no knowledge how to do this. I just knew that I had some things I wanted to say and some stories I wanted to get out. And then this thing just took a life of its own. And here I am 100 plus episodes later, and it just blows me away that it's still going. So I've learned a lot. And I still have a lot to learn. I have learned a lot about how to do a show, the ins and outs behind the show. But in some cases, I don't think I've learned enough. So I need to learn some I don't know, maybe some I keep going back to that word, fine tuning. I just had to figure out what formula works well, not just for me, but for you and for the show. And I hope that the changes I make and the changes that you see and hear, I hope they keep you engaged. I hope they keep you interested. And I hope you keep coming back week to week to listen to what I have to say, what my guests have to say. So I am happy to say that I'm back. I'm ready to release shows starting this week. And I am excited to see where this goes. Welcome to episode 120 of The Things We All Carry. This week I have Alex, and Alex goes by the name at Emergency Resilience. She's on Instagram and TikTok, and she's a fascinating person to speak to. She is a paramedic. She's a continuing education coordinator. She is so much more than that. But our talk today was centered around ketamine, and really kind of centered around her personal journey with ketamine and how you can figure your journey out from hers and what it's like and things to expect and what not to expect and whether you're ready for it or whether you're not ready for it. Is it for you? Is it not for you? There's a lot of questions that we try to answer in this episode. And I hope that this one is helpful. It was fascinating to have this conversation. Alex is a brilliant woman, and she was a pleasure to talk to. And I look forward to hearing more from her in the future. So you guys sit back, enjoy, and then get outside and do something for yourselves.
Welcome back to The Things We All Carry. Today, I'm honored to have Alexandra. And you go Alex or Alexandra? I'm sorry.
Alex.
Which do you prefer?
Alex.
Alex. I have Alex on the show, and you might better know her as at Emergency Resilience. I found her through a former guest of mine, and I send a nod out to Ben Vernon because he's the one that said you have to have her on. And then she and I kind of danced around for a while. You were in a process of a move, correct?
Yeah.
Or something along those lines?
I had to put everything on hold for a while.
Right. And so it's been hectic for you, and now you've got some time to talk to us, and I appreciate it. If you want to give the audience just a little bit of background about yourself, we just talked about that, not doing the long list. So whatever you want to tell us, let's hear who you are and where you're from.
All right. Well, I will keep it short. The short of it is that I have a license, a paramedic license still. I worked as a paramedic, worked on an ambulance for quite a bit. I've been licensed almost 20 years, but for a majority of that time I spent on an ambulance and had a pretty significant back injury that, redirected my career significantly a few years ago. Luckily, I always say I'd already been teaching at that point, so I kind of had a safe place to land. I managed to repurpose what I did with my license and continued to teach. And I'm now a continuing education provider. I create my own online courses, online CE courses. And I also have a PhD in psychology. I'm not a clinical psychologist. I talk a lot about mental health and, that kind of well-being side of things. But I'd like to make it very clear that my PhD is non-clinical. And that's about it. That's the short of it.
I knew I had to talk to you when I saw your tagline on Instagram, and it said, "Come for the death notification, stay for the psychedelics." And anyone that's listened to my show, what's that?
Psychedelic therapy.
Okay, well, I paraphrased. Sorry. Anyone that has listened to my show knows I'm an advocate for, and you're right, it's the therapy because that's important. I'm not saying you should go out and recklessly try psychedelics. I say that they're a tool for a reason, and sometimes you're going to need some direction while you're doing it. So you and I are going to talk about specifically ketamine today. But first, before we get there, can you give your website and your Instagram handle? That way the audience can know who to follow, where to follow you.
Sure. You can find me on, I'm most active on Instagram right now at Emergency Resilience. And my website is emergencyresilience.com. But I'm on all the social pages. You can find me on Facebook, LinkedIn, all that.
Okay. Very cool. And let's get the first question out of the way that I told you about. What's the last song you listened to? I love to ask this question because I'd like to add to the playlist.
I thought you were going to ask this at the end of the podcast.
No, this one comes at you at the beginning.
Okay. So there is a song that actually I'm listening to a lot right now. I kind of get hyperfixated on one song and listen to it ad nauseum, but it's basically a cover of the Cranberries, Linger.
Yes.
And it's
Who's
Brazilian band. I don't know. They're named Royal Otis. The guy, he just looks like a guy I would have had a crush on in 7th grade, honestly. Straight from the 90s. And his voice is incredible. And there's actually 2 cover songs that they've done that were really great. Murder on the Dance Floor was another one. I don't remember who the original artist is of that. But yeah, that's the last song I listened to because not on Spotify. So I have to go find it on TikTok and play it over and over again.
Oh, all right. So there goes my search for later on when we're off the air.
Good.
Because I was going to do that. So I guess it had to be on TikTok, even though I'm trying to stay away from it for right now.
It's so good, though.
All right. So I'm going to play, and I think I told you this before we even started recording, I'm going to play Village Idiot. I know enough about ketamine
to say, hey, check it out, but I don't know enough to tell people why to check it out.
Sure.
And I think that we see that quite often today. We have a lot of people that profess the magic of these things, but don't really understand the whys behind it.
Hmm.
So I guess, where do we start? What is ketamine? Or
Yeah, it's an easy place to start with it. So, ketamine, if most of your audience are first responders, they might know ketamine as a medication that's kept on a rig with, in the drug box. It's a tool that's used for pain management and sometimes used for psychiatric emergencies for sedation, and can also be used in RSI, establishing an airway kind of thing. It just depends on the area that it's being used in. So it's a very versatile drug. And one of the ways that it is become more increasingly popular, and this really started in the early 2000s, so this isn't new, but it's new-ish, I guess, if you think on the grand scheme of things, is to use this medication for mental health healing. And so it is prescribed off-label, meaning it's not being used for the reason that it was created. It was initially created to be used in surgical procedures. And they were able to find out that, hey, like people are actually getting better when they use it for mental health. I'm trying to make it as,
I was going to say, is this kind of that happy accident where,
yeah,
kind of like with EMDR, she's walking down the street and she notices that she did something with her hands, and all of a sudden wait, that worked? Or, the infamous one would be Viagra, right? Because that's created for something completely different. And now it's used, they found off label, and now that's its primary use.
yeah. A lot of people don't realize, they hear the word off label and they think, oh, that's bad. And it's like, no, that's actually real common in our industry. If you've ever, I mean, really in just our society in general, like if you've ever taken a medication to help you sleep and had diphenhydramine in it, you were using that diphenhydramine off label because it wasn't created for sleep. When a medication has to go get FDA approved, it has to pass two things. It has to do what it's claimed to do, and it has to not cause harm. And if it passes those two requirements, then that's what it goes out to be. So if anybody has ever given epinephrine in a cardiac arrest, you've used epinephrine off label. It wasn't designed for cardiac arrest. It was actually designed for anaphylaxis. So things like that, you have to kind of demystify it. Someone at some point identified that, hey, people are actually feeling better after they receive ketamine for one thing. Let's actually study it for depression. Let's study it for PTSD. Let's study it for all these other different things. And even things that it hasn't been studied for, it's used for. So one of the areas that's kind of lacking is anxiety. It hasn't been studied to specifically treat its effectiveness on anxiety, but there are plenty of clinicians out there that are prescribing it for that, and people are finding relief from it, myself included. So to go backwards though a little bit, ketamine is technically not a psychedelic. It's a dissociative analgesic, or it's referred to as a hallucinogen. So it's kind of technicalities. Now we'll get into the chemistry of it, but there are certain psychedelics that are considered classic psychedelics. And while ketamine isn't considered a classic psychedelic, it behaves like one. So it's treated like one as such. So people have to consider the fact that, setting intention, making sure you're safe, making sure that you have an understanding of what you're going to experience when you go into it to reduce the risk of injury, because it, like any other tool, it can be used to heal, and in the wrong hands, it can also be very harmful.
And I think that's the biggest misunderstanding, is people throw ketamine in as a psychedelic.
Yeah, I'm fine treating it as one. I think when we don't respect it like the way that it behaves like one, we can get in trouble with that. And I think that that's why a lot of people that I've spoken to who are giving ketamine for a leg injury, you've got a leg fracture, and they give their patient ketamine, they go, oh my God, like they had a really bad trip. They started freaking out, all that stuff like that. It's like, yeah, I probably would have too. If the providers understood how this behaves, that it dissolves that space between the conscious and the subconscious mind, and how to facilitate them receiving it in a very uncontrolled situation, then they may have been able to act as a sitter and act as as kind of a, what's the word I'm looking for, like a form of safety for the patient to look to for guidance and for support when they started to get scared. But a lot of people think that so ketamine will cause hallucinations, and a lot of people think that hallucinations are just visual, that they see things. And hallucinations, visual hallucinations are just one part of a bigger pie. And that hallucinations can be 8 different types of hallucinations. And the one that people feel the most often is they feel themselves floating outside of their body. And if they're not prepared for that and they don't get told that, then it can scare the shit out of them.
Yeah, I can see that. I can see where someone laying there and they have a broken leg and all of a sudden they're floating above themselves.
Yeah.
That would, and I'll preface this whole conversation with the fact that while I preach ketamine, I've never had it used on me. So I have no idea what the effect actually feels like. So again, I'm playing village idiot because I just don't know.
So now where you are correct that where it's not like a psychedelic is that it is a Schedule 3 substance. So a lot of times people will throw ketamine in there alongside with things like LSD and ecstasy and heroin. And it's like, no, actually, it's not a Schedule 1, it's a Schedule 3. And guess what's also a Schedule 3? Tylenol with codeine, steroids, testosterone, like all those things are Schedule 3s. So a lot of times people will find themselves realizing, oh, I had this kind of like stigma or this association that it's all illegal. But it's not any more illegal than, I mean, as long as a doctor prescribes it and you're using it
Right.
for the intended, prescription and in a clinical safe setting, it's perfectly fine to do, at least legality wise. You're not breaking the law.
Yeah. And I guess for some listeners who might not be familiar with the schedules, the Schedule 1 means that there's no medical benefit and is high risk for use,
Like,
right? Yeah. Yeah. No. Yeah. No, I agree. Throw in the air quotes because I do it all the time. I think all the drugs you mentioned have benefits if used the right manner. And I think that the first person that opened my eyes to that was, and I don't know if he's controversial right now or not, but Dr. Carl Hart with his
mhm,
drug use for adults.
yep,
It's a fascinating book. And this is a
very
gentleman
good
who's
book.
well established in academia
Uh-huh.
and is an avowed heroin user.
Uh-huh.
So, and sidebar, it's interesting that yeah, people don't understand the schedules. So the Schedule 3 drug where hopefully it sounds like marijuana is headed to itself.
Yeah. And the fact that anything has been reclassed since the schedule system came out is historical. It's huge.
Right.
And it's,
Yeah.
there goes marijuana being our gateway drug the way we need it to. It's like, okay,
Now it can be.
yeah, can we get a few more?
And now we can call it a gateway. Yeah,
Yeah.
because that's so anyway, back to ketamine. So they stumble into, okay, this helps people. And now we've talked about how it's not technically a psychedelic, but explain that. How is that? How is it helping?
So the reason why it's technically not a classic psychedelic is classic psychedelics hit specific receptors in the body. And so it doesn't hit that specific receptor in the body the way that psilocybin, which is the active ingredient, mushroom does, the way that mescaline, which is in certain types of cacti, and I can't remember the active ingredient in ayahuasca. And they also throw LSD in there because it also affects those same receptors. So these classic psychedelics kind of have, and honestly, when you go to like a psychedelic conference, there will be a whole track for ketamine. It's not like ketamine's not allowed at the table, but if people want to get the purist, the kind of people who are like, no, that's just these ones, if they want black and white, technically ketamine's not a psychedelic, but it behaved like one. And even though it's classified as a hallucinogen, it has this potential to heal. And how it actually does it is actually a little bit of a mystery. These are still only theories.
Mm,
So, one of them, for example, is that most recently we've come to understand that the opioid receptors do, in fact, play a part and are, in fact, stimulated by ketamine. Now, they're not affected the same way that, let's say, a narcotic affects opioid receptors, but they did find that when they gave these subjects an opioid, blocker, some sort of antagonist, when they administered that and they gave the ketamine, the people didn't have the same effect. So they're like, okay, opioid receptors play a factor. We just don't know what it is. And that's within the last couple of years. So there's very little that we understand about that. Overall, ketamine acts as a reset for the brain. It allows for new pathways to build. So we've heard neuroplasticity. It will enhance and create a big dose of a medicine that can help stimulate neuroplasticity in the brain. A lot of things can cause receptors to get damaged along the way, and trauma is one of them. And it can also act as a rapid anti-inflammatory. So some theories are around depression are that it's actually an inflammation disease. That's just one way to get it, right? Like it's not everybody. Just like we get high blood pressure multiple different ways. So we have beta blockers, calcium channel blockers, all these different ACE inhibitors, different ways to control it. Ketamine acts the same way, and it works different ways on the brain to help induce relief.
I like that you mentioned the inflammation and depression because we were going back to things like the body keeps a score and everything where everything is so interconnected and you just can't, there's not one explanation for everything. And that's the inflammation thing. I didn't know about. So that's fascinating to hear.
Yeah. And, there's a couple of different things. Like one of them is called the BDNF,
Brain derived.
brain derived neurotropic. Essentially, it helps you. One of the things it also does is it almost in a way gives you access to those old memories and those old experiences to go back and heal them like it's happening right now. This is me talking from my experience. This isn't necessarily talking from what you're going to find in a textbook about it, but it gives you access to these parts of yourself that have been buried so that you
Hmm.
can go in and heal them, because a lot of our trauma and a lot of our experiences get stored in the subconscious mind. And in a waking state, we don't readily have access to our subconscious, which is a good thing. We don't actually want to have access to it on a regular basis. But ketamine is almost like this key that unlocks that door. And if we go through it, not knowing what we're going to walk into or not prepared to walk into some of this stuff, it can be very damaging. It can be very harmful, but it can also be very healing and very beautiful. And as heavy as the experiences have been that I've gone through, I should probably also include that I have gone through a series of ketamine therapy to help myself and my psychological injuries. And because I was in a supportive, safe setting with experienced clinicians that knew what to expect, that have done their own ketamine therapy, it was a positive outcome, even if it was a very heavy experience, if that makes sense.
It does make sense. And I think that what you're saying, it unlocks a piece of that subconscious that you're not aware of.
Mhm.
That's how I first heard about it and I forgot where I heard about it there was a woman who had been a victim of a violent rape and she was doing ketamine. And she said, I felt like I was mostly past the trauma, but there was a sticking point.
Yeah.
And she kept having a kind of a breakdown when she would reach the sticking point. So she did ketamine therapy. And she said in those moments that in between that you talk about, she said she's got a glimpse of the action, but it wasn't of the perpetrator or what was going on. It was of the alarm clock next to her. And for some reason, that got stuck in her brain.
Yeah.
And that was what was triggering her back into these episodes.
Wow. Yeah. It's so interesting what our brain decides to hang on to and not hang on to. And, the brain really does communicate in imagery. So sometimes it's just a random thing that gets associated and gets imprinted. Maybe it's almost like, it's almost like thinking of a machine and it just sorted something out the wrong way and you get to go in there and kind of reset it.
Yeah.
Another thing it'll do is there is something called the default mode network in our brain. And they found that that area of the brain is responsible for rumination. And so,
Mm.
like when we have a traumatic event or we have something happen in our life and we think about it over and over again, it's like this monkey brain. It's a really persistent noise in our head. And we can't stop these like intrusive thoughts. It turns the volume down on it and it brings the
Mm.
activity of that way down. So for me specifically, I do have a history of depression. At the time that I started my therapy, I wasn't experiencing depression. And I would say that my depressive episodes that I've had since then have come around less frequently and they last a lot less. Uh, they're much shorter in duration than they used to be. It used to be 2 to 3 weeks every, 3 to 6 months. And now it's
Hmm.
like once, maybe twice a year for a couple of days. So that's been a big thing that I've noticed. But what I specifically went in having struggles with was intrusive thoughts and anxiety. And it was getting to the point where it was affecting my day and I wasn't able to sleep at night without doing certain things that were almost akin to, no, I wouldn't say OCD. I'm not OCD and I don't want to discredit what that actual disease is, but they were very
Right.
weird behaviors that I had to do to feel safe to go to sleep. And they were all based on my intrusive thoughts and fears about what I would do in my sleep. if I didn't put barriers there to stop myself. Let's just put it that way.
Gotcha.
And it shut that off. It like interrupted it. It shut it off. It turned it down. And when I started to notice them come back up several weeks to a few months later, they showed up and fell away. Like they didn't stick. Like
Mm.
a therapist that I work with describes it like Teflon. I get the trigger, or the image, or the thought and idea in my head, and it falls off like Teflon instead of Velcro. And then I don't take it on a spin and, go create stories in my head. So it can really help to almost induce, and this is my words, it almost felt like it induced a chemical meditative state.
Hmm.
And it was such a
Makes
timeout. It was a really needed timeout.
Yeah, I like that timeout. Like that's a perfect analogy. I mean, yeah, you just go, okay, step away, and it doesn't fix, like you said, but I like that mute button, basically.
Hmm. Yeah, no, it does. And I'm not trying to sell this as like the end all be all. It is a tool. It is not a magic pill. It will not fix everyone. In fact, one thing I'm learning and I'm working out with my therapist is that, wow, I got through all of that stuff and I just found deeper, darker stuff that I didn't even realize was there. So you really have to make sure that you understand that it's the start of a bigger journey. That
Yeah,
yes, I feel like I'm healing parts of myself here only to get deeper and darker at times. And if I didn't have the support that I have, that could go sideways really fast.
yeah.
It could.
Well, and I was going to bring up a couple of points, and I think that and again, I'm just a layperson. I don't have a scientific background. I haven't studied anything, and in my mind, I'm thinking this trauma. I've decided that I do want to talk to somebody who has studied trauma and the effect on the brain in the sense of what is the physical effect on the brain? Because I know there's some, like you said, the neuroplasticity, because the trauma does change a brain.
Mhm.
And so to get around some of that, we use something like ketamine to increase neuroplasticity and to create those new pathways so you can get around that thinking or around the actions, right? Is that kind of the easiest way to say it?
Yeah. Now it works. It has so many different mechanisms and ones that we're not even entirely sure how it works. We just know that it does work. And we know that it creates a rapid relief of depressive symptoms. And one of the more gold standard studies that was a double blind placebo controlled, they found that after a series of 6 ketamine sessions, people had relief from their symptoms on average 42 days, which doesn't sound like much, but to someone who has tried
Mm,
medication after medication that's on the verge of suicide and having just poor quality of life, 42 days is the difference between them staying and them going, I'm out, I'm done with this. And that's average, so some people had longer, some people had shorter. Not everybody's going to respond as hoped for with ketamine, but for those who have access to it, meaning they have a ketamine clinic nearby, they're usually more available in metropolitan cities and bigger
yeah.
cities. But for someone who has an ability to have access to it and can financially afford it, it's worth a shot.
Well, and I guess when I'm thinking about trauma and thinking about these physical changes on the brain and something like ketamine coming in and increasing neuroplasticity, my immediate thought is when you have such ingrained trauma as some first responders do, can talk therapy even touch some of that stuff? And is it like a fantasy to sit here and go, oh, go to therapy, and it'll start to fix what's going on? Because it's not changing the neuroplasticity in the brain. And it's not giving you new pathways to get out of that darkness.
So it's kind of there's a lot of debates around that about whether or not talk therapy will work. And I say this with all the respect in the world for every therapist that's out there. Talk therapy alone is not enough. But to do this kind of work without talk therapy would also be a disservice to how
Perfect.
it works. Plain and
Right.
simple. Like it's not just going in, getting the treatment, coming out and figuring it on my own. It's the fact that I have a therapist who has a lot of experience with her own psychedelics. She's in her 70s. We didn't see each other for like a month last year because she was in Peru doing ayahuasca in the jungle with the elders. And like, just, she's got her own work
Nice.
that she's done as
Right.
medicine. So she understands the integration part. She understands the imagery. She understands the importance of the dreams that come up in the days following it. And so we actually will plan for, if I do a ketamine session, we'll plan to have an integration talk therapy of up to 2 hours the next day. So the day
Right.
of, I'm too exhausted. I'm still processing. Sometimes I'm a little hungover. just depending. But I will see her the next day. And it's the work I've done with her that really makes a big difference.
I've kind of forgotten what the second point was that I was going to make. I should write these things down as I go, so it'll come back to me, I'm sure. I just, for you, what does maybe not for you, but in general, then let's go through that. What does a typical session look like for people if they're going to walk in and go, okay, this is my first time. What's it like?
So that's a good question. Not all ketamine clinics are built equally. Some of them are set up a little bit more sterile and clinical, like an urgent care, I've been told. Because you got to think about it. Ketamine came up in the ranks through Western medicine. It came in through the surgical
Mm.
setting. And there's a lot of practices that haven't really strayed too far away from that. Then there are people that understand ketamine from the perspective of traditional psychedelic practices, and they'll create this very kind of sacred, healing,
Mhm.
calming environment. Like you almost think you're walking into a place where you get a massage or you go to a day spa, if you've ever been to one. But you have the calming music, you have the aromatherapy, it's aesthetically pleasing, it's comfortable, it's safe. And you'll always have a overseeing physician or nurse practitioner, just depending on the area, that can actually prescribe it. And then you can have nurses or sometimes even paramedics, just depending on the areas, that are actually administering it. Very rarely will you find a practice that also has a therapist that does integrative sessions as part of the packages, but that doesn't mean it's a bad place if they don't have it. It just means you need to provide your own. You need to find your own to do that with. So the place that I had been going to, they had everything that I just described on the latter end of the spectrum. They didn't work with therapists. It didn't make it ideal for me, but it was still workable because these were clinicians that had all done ketamine therapy. They understood what they were putting me through. I trusted them. And based on our consult together, this was a good fit. And so I just basically coordinated it with my therapist and was able to bring my therapist to the table. And something you had said earlier that I want to come back to that we kind of lost a train of thought on was you said, just talking doesn't do enough. And it's like, I would say something that gets really, there comes a stopping point with talk therapy. And I remember my first therapist having a realization with me and having this conversation with me where she said, I've taken you as far back as I can go. You need to
Mm.
start working with the subconscious. And so she referred me out to a different therapist. So for a while, I had two therapists at once because one focused as far back as she could go consciously and going forward. And so they can teach you coping mechanisms, they can teach you boundaries, they can teach you how to process things going forward. Um, but this therapist, and being wise and being very experienced in trauma, we've gone back as far as we can go. There's something deeper that we can't hit on this level. I think you should start working with so and so. So that's when I started doing subconscious work. And ketamine is very much subconscious work. Any type of
Right.
psychedelics is subconscious work. And so, like I said, it's not this or that. It's you need both. You always need both.
When you're in that session, and I'm guessing what it's a slow drip over a period of time, and you kind of it's a slow rise and slow kind of like bring up into that state.
They will take your vitals. They'll hook you up to
Hmm.
kind of a monitor. If you're getting IV ketamine, you'll be cardiac monitored throughout the whole thing. If you're getting IM or sublingual, usually not. Especially sublingual.
Okay.
Sublingual is usually done in different settings, and then they'll monitor that. And yeah, they start an IV, and you're given usually anywhere. You could start anywhere between zero point 0.1 to zero point 0.5 milligrams per kilogram and work your way up from there. But you start at a very sub anesthetic dose. It's very on par with what many agencies give ketamine for pain. And they give it. Here's the kicker though, is that in pre-hospital setting, like let's say the area I work in as an EMS coordinator, we give zero point 0.3 milligrams per kilogram over 5 minutes. My first ketamine session, or one of my first ones, was zero point 0.3 milligrams per kilogram over 60 minutes.
Okay.
So when I think about like the ride that I went on,
Right.
I was like, these poor freaking patients in five
Right.
minutes, they have to get that, like, forget it. And so
Yeah.
personally, I do not like getting IM ketamine in too high of a dose. You can get IM ketamine in too high of a dose and be in a K-hole like that. And
Right.
that's kind of, that can be scary if you're not expecting it. And I say that because a lot of the IM doses for ketamine are very high. And we have to remember that that's all at once that they're getting it. And it can be very effective to get what you want, which is to sedate the patient. But watch out, because people come out of ketamine the way they go into it. So that's why, if we can, and in a therapeutic setting, that's the importance of bringing them into a calm environment, making sure they feel safe, making sure that consent has been explicitly received and that they understand what they're going into, so that they feel safe on their way out of that journey.
So when you say you get that over a 60-minute period,
Mhm.
that's such a slow drip that when do you start to feel like, okay, this is starting I'm there.
So within seconds, I feel myself lift off, and I mean, it's very rapid. And, you just kind of coast. They get you at a therapeutic level and they just kind of coast. And then I can actually feel myself land, and I can feel myself come back into my body before I even
Hmm.
hear the beeps go off for the pump to say it's over. And so it's supposed to be a very steady experience.
And through that time, because you say you're not doing it with a therapist there.
No.
So through that time, all you're doing is kind of just, you've got something you want to focus on, or how are you going into that session?
So, one of my first sessions, I was prompted by one of the clinicians, um, with kind of a mantra, if you will, of show me what I need to see. Like, let my subconscious do the talking. It's very intelligent. Our psyches are very intelligent, and they are the keeper of all of our secrets and keeper of all of our behaviors. And when you stop and think about the fact that 90 some percent of our conscious actions and behaviors and thoughts are driven by subconscious programming, we're trying to get down in there. So we're not the experts in that. Our bodies are. And so my very first session was all about grief. I sobbed, I cried, I grieved. And I
Hmm.
had this realization afterwards that all the things I was grieving were not mine. They were all things that I felt and I was carrying from people around me that had suffered immense loss. And so reminding me that empathy is okay, but it's also important to discharge that and know it's not mine to
Yeah.
keep. It's mine to acknowledge and use that as a way to find a common ground and comfort and connect with someone else, but that it's not mine. That's not mine to
Yeah.
carry. And I was carrying it with me for longer periods of time than I needed to.
That's, and sidebar, that's brilliant, because I think we all do that in these professions, right? If we have any empathetic care or empathetic bone in our body, we're taking some of that on. And that's exactly what I talk about in the show. And it's the things we all carry, right?
Yep.
And I don't do enough of the discharging myself to go, okay, I'd take all this on, but then where do I dump it when I'm done listening and editing shows? So it's something I need to be way more cognizant of. And so I love the way you put that. So thank you for saying that. I like that.
Yeah. Yeah, you're welcome. And so yeah, every time's kind of different. Sometimes, I mean, I've had immense emotions, like just emotions I had never even felt before. And I remember not all the sessions are heavy and crying and weeping, and not all the sessions are joyous and enjoyable either. Spectrum, it's whatever's going to come up that day. And I had one session where I felt an immense amount of joy, like joy I had never felt before in my life. And
Nice.
it was so unconditional. And so a lot of these things are things that I take with me out of that session and just have this ability to reflect on and find the meaning. Like, it doesn't always hit me during the ketamine therapy. And one of them was that, wow, I have never let myself feel that kind of joy before. I never felt safe enough to feel that kind of joy. I have disenfranchised myself from feeling that joy because I've always thought, well, sounds too good to be true. The other is
Yeah.
going to fall, like waiting for the other shoe to drop. And so always preparing for disaster and not actually letting myself feel joy was something that I realized I didn't just want to suppress the sadness. I was also suppressing my ability to feel joy. And so I walked away from that going, oh, well, that makes a lot of sense for in a lot of ways.
Well, we'll figure it out.
Come back to it.
And before we continue on with what that whole journey is like in the setting, I think that has got to be, I know for me, if I was to say I'm going to go do ketamine, which is something I've considered, But for me to go, I'm going to go do this. But it's what you just said that kind of gets people worried. It's that subconscious is like, I'm going to find out those things that I don't remember.
Mhm.
And I don't know if I want to do that. So like, can you speak to that? Is there a way to kind of calm those nerves about that? Or is it, no, that's part of the work?
Some people aren't ready for it. My sister's one of them. There's so much blank tape in her psyche and not being able to recall certain events. And I'm like, therapy would help. She's like, nope, it's fine. Like she just wants to keep it in Pandora's box. And that's why it's not for everybody. And if anyone says, oh, I want to, but I'm too scared, then it's not time yet. You'll
Right.
know when it's time. You'll know when you're fed up with your own bullshit and when you're tired of
Mhm.
trying everything else. And you're like, you know what? The fear of what's unknown is less scary than the fear of where I'm headed. And you also have to make sure you do your research. You understand what you're getting into. You understand what the purpose and intention of this medicine is and what the risk is. There's always a risk with anything. And those are things that people have to go into and having a medical clearance before you go into it is also part of the process.
Thanks for listening to another episode of The Things We All Carry. Head over to the website, thethingsweallcarry.com for show notes, resources, and to sign up for the newsletter. Until next week, take care of yourselves and remember to check in on each other.